had scary or intrusive thoughts about harming your baby or harm coming to your baby and been afraid to tell anybody about it, you're not alone. My name is Dr. Scott. I'm a board certified psychiatric nurse practitioner. I'm also a third time postpartum mom. And so today I'm talking about postpartum OCD. I feel like this is one of those conditions that's not talked about that much and actually also not that well understood. And so I'm going to break it down today. Postpartum is actually a time where it puts a woman at increased risk of having new onset OCD or exacerbating a previous diagnosis of OCD. Often show up as obsessive thoughts of harm coming to the baby or the mom having obsessive thoughts about actually harming her baby. It's important to note that the mom doesn't actually want to hurt her baby. And so this condition is actually what we call ego dystonic. So it goes against like the values, beliefs of what a mom really feels. She does not want to actually hurt her baby. This is a key feature of postpartum OCD. And in this, women with postpartum OCD are not at risk of actually harming their babies, even though they have these thoughts or these worries that they might harm the baby. This causes extreme distress to the mother. This can also translate to her having a difficult time being around the baby just because the thoughts are so distressing and so intrusive. Another way that it might show up is intrusive images. And these images might look like the baby falling off the changing table, maybe the baby falling, really disturbing, distressing images. The other feature of this, outside of the obsessive thoughts, are the compulsions. And the compulsions can look different, but this could look like a mom checking on the baby over and over multiple times in a night, even though the baby is okay, even though the baby is not crying. This can also look like her compulsively washing her hands. This could look like compulsive sterilizing of bottles, of pacifiers, and checking things over and over. And this postpartum OCD can actually lead to some depressive symptoms. And other obsessive thoughts can actually also include the mom perceiving there to be something wrong with the baby, maybe a problem with their health, or repeatedly asking for assessments or repeatedly asking for questions about the baby's health status. In postpartum OCD, the lifetime prevalence is about 1% to 3%. So that sounds small, but it does occur. There is help for this, there is support. You are not a bad mom. These symptoms are treatable. Follow along for this series on postpartum mental health. See you next time.